Bariatric surgery is a weight loss surgery, although I don't like to characterize it only as that. It's more of a metabolic surgery. It changes the way that your body functions, how it interacts with the different organs. Obesity is a #1 leading cause of preventable death in the United States now. It's surpassed smoking. For that reason, bariatric surgery and GLP-1s and things like that have gained a lot of interest. Bariatric surgery has proven to be the most sustainable means of curing some of these comorbid conditions or conditions associated with obesity long-term and having the best safety outcomes. Here at Dignity Health Arizona, we do primarily 3 different surgeries to aid in weight loss. This is your liver, gallbladder, stomach, pancreas, and large and small intestine. Now, the surgery most commonly done in the country and across the world is called the sleeve gastrectomy or vertical sleeve gastrectomy. What that does is basically remove this portion of the stomach. Now, that narrows this area down to make you feel full sooner, and it removes neurotransmitters here that control hunger. So you lose weight with the sleeve because you feel full sooner and you don't get as hungry. Now, you can add to this by going down here past the end of the stomach to the first part of the small intestine called the duodenum, and bring up a piece of small intestine from lower down and sew it in here. That makes it so food will pass like this and skip this first portion of your small intestine. By doing this, you don't absorb certain things that would otherwise be converted to fat. This is a modification of the traditional duodenal switch called a SADI procedure, S-A-D-I. Now, if you take what we define as successful bariatric surgery, that means that you lose more than half of your excess body weight and maintain that loss for greater than 5 years. That number should be at least 70% of all the people that undertake this surgery. Understanding that there are 2 considerations when someone meets criteria for weight loss surgery. There's the medical considerations, which are usually a no-brainer. It's safer to have surgery than not. There is a misconception that these surgeries are high risk. The outcomes of the surgeries and the immediate risk factors are in line with having a hernia repair or gallbladder surgery. They're very safe these days. They're done through minimally invasive methods, either laparoscopically or robotically with very small incisions. People's recovery is fast, generally doing most of what you want to do in less than a week. Back to work in about 2 weeks on average, just with some limited lifting restrictions for about 4 weeks. The long-term results of bariatric surgery can obviously vary with people's personal commitment. I have a discussion with patients before that there's a medical argument to be made, and if they meet the criteria, body mass index and those things, that they're a good criteria, then they are a good candidate medically.